now to the most important part of every show. Our guest today is Elizabeth McKeon. Did I get McKeon
You
right?
sure did, Rick.
That is always a challenge. She is COO at HealtHIE Georgia, and she has her own podcast. I think in May.
Yes.
It started in May, called the Clearly Well Podcast. Welcome, Elizabeth.
Thank you so much for having me, Rick.
Tell me, what is HealtHIE Georgia?
So, HealtHIE Georgia, basically, we support healthcare and behavioral health, substance use disorder programs, and we leverage grant funding in order to bring these programs into rural Georgia. Currently, at this time, we only serve rural Georgia across the state. Some of the I guess like our best programs is a program called Recovery and Reentry for Detention Centers, and that is really through our Behavioral Health Support and MAT grant. MAT stands for Medication Assisted Treatment for Substance Use Disorder. We actually work with inmates to give them a success strategy on the other side. You know, we all know that we have a huge problem with the opioid epidemic. And what happens a lot of times is these folks are in jail, they get sober there, but there's no true success plan on the other side when they leave to go back into general population. So what we do is we provide them with a peer support plan while inside, give them some substance use treatment, some psychosocial support, and then when they leave, actually we look into insurance for them as well and possibly a resume strategy. And then when they leave, we give them a success plan to include that medication-assisted treatment to prevent an overdose. Currently, we have that working in Rabun County. I have spoken with Cliff Bradshaw as well as Ken Henderson here in Towns County about leveraging that program here in Towns County. They are very supportive of that. So I hope in probably 2025 to bring that program also to Towns County.
All right. Pretend that I'm like a 2 or 3 year old. I guess 4 or 5 year old. Break it down. Someone gets arrested. I take it they're convicted. They go to jail, prison, what have
Right.
you. How do y'all reach out to them? How does the process
So
work?
you have to actually have that good relationship with your local law enforcement, and that what that means is that we reach out. We reach out to local law enforcement and tell them about our programs, and we show them the data and the statistics about recidivism. Recidivism meaning how many times do you go back to jail? How many times do you show up in the hospital emergency department? And we know that the hospital emergency room and jail see the same folks. And oftentimes, the folks that are there on like petty crime due to their substance use and mental health problems, and they haven't possibly due to poor social determinants of health. They have not had good, let's just say, good support, and so by opening the door to the conversation to local law enforcement, getting their support for these programs. They invite us and our peer support specialists. Now, peer support specialists are folks with lived experience. These people have to have 2 or more years of soberness. And these are people that formerly had substance use disorder and have come through incarceration themselves in most cases. These are also the folks I interview on the podcast, by the way. Really, really great stories of recovery. And they go in and they do psychosocial support within the jail, and they say, look, I'm a prime example of what you can be if you just will try. Now, these folks have to be ready for that. Not everybody is. So our programs are voluntary. Anyone that wants to receive that support while incarcerated, we give it. You also have to have the support of whatever healthcare agency is in that building, meaning that there are nurses and doctors within the detention center that are agency. We have to work with them as well and say, do you mind if we come in and aid you in helping these people get well? And we have had good success with that too.
Do you just from a practical standpoint, do you have a list of those that are incarcerated and their history, and you reach out to them directly?
So what we do is actually at the time of processing, we do a screening. We screen them at that time of processing for substance use disorder through a peer. Because like, say myself as a nurse, They might not want to be honest with me because I don't have that lived experience and I'm not in recovery myself. So they might think of me as maybe judgy, right? So if we take a person with lived experience and let them do that screening and say, hey, you can be honest with me. Have you been using these drugs? What drugs have you been using? Do you also suffer from any mental health issues or disorders? If they're honest and we can help them, we can make sure that they don't go into an improper detox situation. If they need to go to a crisis stabilization units, then the jail has the knowledge to know that they probably need a clinical detox rather than to have that rough detox while in jail. And jails don't want that. They don't want to see that happen. So we're actually able to capture that on the front side of incarceration. That's working really well for us in Rabun County. We've been able to get folks over to a clinical detox situation. And that's very much appreciated by the interim sheriff there currently, Beth Darnell.
Do you ever have family members reach out and say, "Hey, can you?" I would think this is something where, if I had a family member that they've made some mistakes, I might would reach out to an organization like this and say, "Hey, can you help us?"
That does happen. What I unfortunately have to do a lot of times is have that hard conversation with family and say, I really have to have this person be ready. I know you're ready. You're struggling watching your family member make these poor choices, and really they have to have hit some sort of rock bottom, and that rock bottom looks different for every single person. And I do want to mention that in order for us to have sustainable programs, because we are grant funded, what we try to do is we try to get processes in place where there's actually a billing model and a way for people to make money or at least break even during this. So if you're lowering that recidivism to the jail and you're lowering hospital recidivism, you're actually helping your community. Because I think we all know that a lot of times the folks that enter the emergency department may not have insurance or they have Medicaid. More often, they don't have any support for health care. And so these do become sustainable programs because of that. And the peer support specialists are a billable model through Medicaid. So I actually teach the billing codes for that. Not only can your organization, any organization that's treating folks with jail in reach, you can bill Medicaid for those peer support specialists. So it is a sustainable model after those grants are gone.
Now, when you say grants, is this multiple grants? Is this federal grants?
They're all federal.
Okay.
I work primarily with HRSA grants, which more familiar to our local Americans here is going to be CMS, the Centers for Medicare Services. So that is the backbone of our grants, as well as the RCORP grants, and the RCORP grants are the rural opioid funding grants. So we have a behavioral health support grant, we have a MAT access grant, and those are the grants that we're using for our recovery, reentry, jail in reach programs.
Very good. Folks, this is pretty in-depth today. It's a little different, but I thought a very important show. Today, our guest is Elizabeth McKeon. She is COO at HealtHIE Georgia. We'll be right back after these commercial messages. As always, thank you so much for tuning in.
Whether you're buying, selling, or looking for the facts, welcome back to Mountain Real Estate with Rick Andrews.
Folks, as always, if you're looking to buy or sell here in the beautiful Blue Ridge Mountains, please allow me to interview for the job. My name is Rick Andrews. My number is 828-557-9139. Now back to the important part of the program. Our guest today is Elizabeth McKeon. Elizabeth, you got a lot on your plate.
I do.
What led you here? I mean, this is unique. This is heavy stuff.
It really is. So I'll take you guys back, and I think a lot of your listeners have probably heard me before here when I was with the Union General Healthcare System. I moved away. I'm a born and bred little Murphy girl. A lot of people knew me as Elizabeth McKeon, Coach McKeon's daughter. But I moved away, went to nursing school out in Las Cruces, New Mexico, and got my psych nursing career started there. Really learned that our border population had a problem with homelessness, substance use disorder, and mental health. Moved back here in 2016 and married Brett McKeon, who works for you, by the way.
That's Century 21 Black
That's
Bear
right.
Realty.
Century 21 Black Bear Realty.
But I will say this, as off the air we kind of discussed this. I get you with him now. The psych nursing, I kind of get knowing Brett. I get it.
All
now.
the Murphy folks will appreciate that.
You're helping him.
That's hilarious. So then I actually started the 2 East Behavioral Health ER holding at Murphy's, now Erlanger, and then was recruited to come over to the Union side and opened several programs for the Chattooga Regional Hospital. Most importantly, the Clearview Intensive Outpatient Program, where we helped folks in the community with substance use as well as just behavioral health diagnoses that were that they were having problems, oftentimes intractable diagnoses, meaning that medication was not helping and that they needed more psychosocial support. And so that was really great. But during that time, I got to know HealtHIE Georgia. And the owner, Mark Renfro, started interviewing me at that time about opening programs in the North Georgia part of his region. He had been primarily in South Georgia opening a lot of the kinds of programs that I had been successful in opening. And over the years, and I will say this, that beautiful facelift that you guys see on the front of Chattooga, that's a HealtHIE Georgia funding program through the Red Leg USDA grant and funding. So we actually, the company I work for today really was partnered with Union General even way back then. So now I was recruited to come to work for them back in September of last year. And I want to say, I think I'm really proud to say that I am one of only 286 nurses in the United States that have a board certification in addiction and recovery, as well as a board certification in psychiatric mental health. I'm about to graduate with my psychiatric mental health nurse practitioner as well, starting clinicals very soon in that arena. But was just very lucky to get promoted to Chief of Operations for HealtHIE Georgia. So I'm really running programs across the state right now for the Jail and Reach Recovery Reentry Program. Primarily right now we are heavily focused in the area of Claxton. If you guys aren't familiar with Claxton, Georgia, that is the Claxton Fruitcake Company is located there. And I work with the Evans Memorial Hospital out there near Savannah, as well as the Community Service Board of Middle Georgia in Dublin. Those are two of my primary focuses right now, along with Raven County. And as I said, really hoping to move into Towns County pretty quickly.
Sounds like HealtHIE Georgia does a lot more.
Well, we do, and we work with the New Market Tax Credit for commercial real estate as well. So I offer programs to folks that are looking for having loan forgiveness. If you guys aren't familiar with the New Market Tax Credit, that is a way to fund a sustainable program to help a community and get that loan forgiven on the other side. If you can show that in 7 years and you paid only interest on that loan, that loan will be forgiven. So that is something that we also do for folks, and it does not have to be in behavioral health or substance use disorder. We help folks. We're actually getting ready to help a hospital over in Elbert Memorial Hospital. We're going to do a new market tax credit loan for them to bring imaging and a lot of programs to grow their hospital that don't have anything to do with behavioral health. So we really, even though we have a big focus in mental health and substance use disorder, we bring all kinds of programs to hospitals.
Okay, let's shift gears. The Clearly Well podcast. How did it come about? Educate us.
So during my years as a psych nurse, I started listening to mental health and substance use disorder be two topics.
And of course, being married to Brett.
And of course, being married to Brett. So what I realized was that mental health and substance use disorder belong in the same conversation all the time. And what we say in healthcare is it only belongs there about 60% of the time. And what I was noticing in every assessment I would do with the patient, it was 100% of the time. And truly what I will say is that has more to do with billing and insurance than anything, and that's just wrong. So I decided to make a podcast that talked about substance use disorder, but let's dig deep and find out, where did the mental health problem start? And in every single guest, you will see, as they go back to childhood, you can identify the moment, whether that's their parent left them, whether they were abused, or whatever the case may be. There was always a pivotal moment in their story that they had a mental health diagnosis, most of the time that was undiagnosed and untreated. So that is the podcast. It's really just a journey. People's testimony, their stories about their recovery. Some of it's hard to hear. Even the folks that I know on there that I thought I knew them, I find within the podcast I didn't know them at all.
If someone would like to listen to your podcast, where can they find it?
So we're on Apple Podcasts as well as Spotify at this time at the Clearly Well podcast. I have a TikTok, I have an Instagram and a Thread at this time, no Facebook yet. I find myself with full-time school, full-time podcast, full-time work, that I'm a little bit spread thin. I do a lot of travel. We have about 16 episodes right now on the Clearly Well podcast. Just all really good stuff. Our last guest, Kayla Calfiore, out of Miami, a Latina, beautiful, beautiful girl. Her story of recovery, just really great. Lots of good listening on there. I encourage, even if you don't have a personal story, everyone knows someone with a story.
Sure.
We all have been affected with substance use disorder, and we're in trouble. And I think we know that. Our fentanyl is now called xylazine. There's always something else polluting something else coming from China. We have just so much going on with the drugs that are polluting our children and our population. And Georgia is in trouble with that. So we're seeing a lot of pollutants, even in the fentanyl now, that are very, very hard to pull people back from, that Narcan doesn't even work on anymore.
Wow. If someone, let's go back over it for those who perhaps would like to hear, like to learn, like to listen, where can they find? They go online?
They can go online at Spotify or Apple Podcasts. You can also email me at clearlywellpodcast@gmail.com. That's clearlywellpodcast@gmail.com. And we appreciate if you would like, follow, and share our podcast. Thank you so much.
Folks, as always, we really appreciate you tuning in. We'll be back next weekend. Thank y'all.
Thank you, Rick.